We are seeing more and more personalized medicine. In all the aspect of the management of breast cancer, we have seen that in the screening programs, the use of different types of mammographic devices like the tomosynthesis is getting more breast cancers than the digital mammogram. So I think in terms of screening and radiology, there are several advantages. We had also some experts talking about how do we screen patients, women, because they are not patients yet, how do we screen women? And I think it's important also that we are trying to define which women are at high risk of breast cancer and have a different screening programs than the general population that don't have so much risk. So I think in the aspect of prevention or detection, there are several factors and several studies that is going on just to individualize the screening program. So I think that's important. In terms of surgical procedures, neoadjuvant treatments are important because this is the best way that we can prove that new drugs are working in patients. We can see the effect of those drugs, and we can monitor the patients during the treatments. And of course, giving all these treatments in advance, we can also do more conservative surgeries on them, and we can do treatments with less morbidity. So I think it's important. We are still working on the gene profiling of the tumors. This year we will have the results of the MINDAT trial. They are not yet for this meeting, but there will be in the next months. So that will give us some more different treatments for the patient and which patients can avoid chemotherapy and other treatments. So that's something that we will have in the very, very, very near future. I think it's also important that we are investigating on liquid biopsies. We are trying to analyze what's the prognostic impact of finding CTCs on the liquid biopsies and the free DNA. Those are some investigational type of biopsies that we are doing, and we don't have ready the clinical applicability of all this, but I think we are on the way of finding another ways of having more accurately what's the prognosis of our patients.